Assalamu alaikum. My name is Noor Mustafa and I am a student of Dow University of Health Sciences and I am currently studying in third year in the field of Bachelor's in Dental Surgery, which is known as BDS. So the topic of today which I chose was oral MALADOR and halitosis. Which basically means bad breath or malodor which comes out of our oral cavity or mouth as we breathe. So the things which I'll be discussing in this topic are going to be with the basic introduction about it and the causes which basically leads to such a condition or a disease. It is basically a disease and the treatment also for such a condition. So as we start, halitosis stands for a term used to describe noticeably unpleasant odor exhaling in breathing. So as we breathe outside the bad breath which comes out of our mouth, the medical term for it is known as halitosis. Oral malodor is the term used to describe the unpleasant odor from the oral cavity. Breath malodor is different from temporary disturbing odor caused by food intake, smoking, morning bad breath. So basically oral malodor and breath malodor are two different things. Breath malodor can be temporary while oral malodor can be regarded as a disease. Persistent breath malodor does reflect some pathology. Halitosis is synonym for breath malodor and bad breath or foul breath. So the categories in which we are going to divide halitosis are genuine halitosis, which means actually the person has some sort of bad breath or malodor when breath malodor really exists. It can be physiological or pathological. The physiological is a transient malodor by food intake or smoking or some kind of medication which may cause a bad breath, while the pathological condition which deals with the pathology of microorganism or some sort of disease can be further divided into intraoral halitosis and extraoral halitosis. Pseudo-halitosis, as we know, pseudo means false. It is a false form of halitosis in which a person sort of perceives that the patient which sort of perceives that he is suffering from a bad breath, while halitophobia or imaginary breath malodor is a fear which a person has that some kind of a bad breath or odor might be coming out of his mouth, while in reality there is no such case, and this can actually be a form of psychiatric condition which can be treated with proper medications. So epidemiology basically means how widespread it is around. It is a basic social problem. Several studies in industrialized countries report an incidence of as high as 50%. No gender predominance can be seen. Previously, it was regarded to be a higher occurrence in females, and the age ranges from 5 years to 80 years. So basically, it's a broad spectrum in which this basically occurs. Now, etiology basically means what causes these bad breaths. Majority originates from our oral cavity. Gingivitis and periodontitis basically mean inflammation of the gingiva and the periodontium, which surround with our gums and cover our teeth and everything. And the tongue coating also are also a cause of predominant factors which are part of the etiology for causing oral malodor. The extraoral causes can be some form of systemic disease such as diabetes, metabolic or hormonal problems, hepatic or renal insufficiency, and bronchial carcinoma, which means bronchial cancer, gastroenterological pathology, or hormonal causes. So when we further discuss about the etiologies, generally two pathways for breath malodor can be seen. One is extraoral and intraoral. So the extraoral is an increase in certain metabolites, certain products in the blood circulation in our blood, which can be regarded as systemic disease, which will escape via alveoli of the lungs during breath, which means the lungs, as we breathe, there's a circulation system inside of our lungs as we breathe. So through that systemic disease, through our blood, it exchanges with the alveoli, and through our lungs it comes out from our mouth. that is an extraoral halitosis. Intraoral halitosis is an increase in either bacterial load or the amount of substrate for the bacteria at one of the lining surfaces of the oropharyngeal cavity, the respiratory tract, or the esophagus. These are basically the organs which are located through our respiratory tract and everything. Okay, so the unpleasant smell of breath mainly originates from VSC, which are volatile sulfur compounds. These can be further categorized further into hydrogen sulfide, methyl mercaptan, dimethyl sulfide. These are the compounds which can be found in some food substances or other substances which we intake, which can cause production of such things which cause MALADOR or bad breath. However, other compounds in mouth air also offends, such as diamines, indole, scatol, butyric or propionic acid. The extraoral causes are much more difficult to detect, although sometimes recognized by typical odor. Sweet odor of ketones in diabetes. If a person is suffering from diabetes, you will notice some kind of a sweet odor coming from his mouth. Liver disease, by sulfur odor, a sulfur type odor will be coming from his mouth, and if a person is suffering from a kidney failure, fishy odor will come from his mouth as if he has eaten any kind of fish. Mostly malodors express themselves when they become volatile. Okay, so I'll be briefly describing these intraoral causes. Tongue and tongue coating. Basically, the coating on our tongue, we're going to talk about that. The dorsal or the upper part of the tongue is a very irregular surface which consists of papilla and folds. These are basically manicules, small from micro perspective. We can see papilla on our tongue, and what basically happens is that these are ideal notches for bacterial adhesion. Bacteria can easily combine over here and attach themselves to the dorsal of the tongue and can easily grow over there. Fissure tongue or hairy tongue are other cause, and dry mouth, which basically means if saliva production is very low, then dry mouth can occur, and which increases the microbial load, which means bacteria can increase in our oral cavity and escape of VSC as gases, which are sulfur compounds. Now we can see over here about a hairy tongue and different clinical pictures of heavily coated tongues, and such conditions can tentatively produce oral MALADOR. The intraoral causes can further be categorized as dental pathologies, which are deep caries lesions, which means कि दांतों में जो कीड़ा लग जाता है. Food impaction, which means कि अगर दांतों में जो है कुछ फंस जाता है, या purulent discharge, which means a kind of a fluid discharge. These conditions can also cause bad breath and MALADOR. Periodontal infections, which means bacteria associated with gingivitis and periodontitis, which basically means inflammation of the gum, which causes redness and everything. And gram-negative, almost all gram-negative bacteria can be associated to produce sulfur compounds. Extraoral causes can be ENT infections, which means ear, nose, throat infections, bronchi and lung, gastrointestinal tract misconception. It was basically a misconception about this also being a cause, while liver, kidney, hormonal causes and medication are also extraoral causes. Okay, so if a person with a bad breath basically comes in our dental OPD, so how are we going to diagnose it? Diagnose basically means how are we going to identify that the person is actually suffering, or is it a pseudo form of breath MALADOR? Basically, thorough questioning is going to be done from that person, and the frequency is going to be asked at how often does his does bad breath basically occur, and the time of appearance, is it during day or when it basically happens, and when it first appeared. Others have identified the problem in different ways, and medical history needs to be asked, and the medication which the person is taking, and any systemic diseases which the person might be suffering from. Is his mouth dry, that saliva production has been reduced, or other habits which the person has, for example smoking or drinking, or other dietary habits, for example eating garlic, which basically causes bad breath. And dental history is basically asked also. So these are the things which we need to consider when a person comes in dental OPD. Okay, so when we come to the aspect of treatment for breath MALADOR or oral MALADOR, or halitosis. The treatment of oral malodor or intraoral origin, if it is of intraoral origin, should be cause related because oral malodor is caused by metabolic degradation of available proteins in our body that can also cause bad breath. So how can we reduce or treat such a condition? We can treat by, for example, using mouth sprays, mint containing lozenges. For example, lozenge, we can take an example of strepsils, and such lozenges are available in market, which basically help in reducing bad breath. Mechanical reduction, which basically means proper toothbrushing and tongue cleaning with normal toothbrush, but preferably with a tongue scraper, reduces halitosis 75% after 1 week. So this is a very good method to reduce bad breath. Chewing gums can also control bad breath temporarily because it can stimulate salivary flow. As we saw, dry mouth is a condition which can cause bad breath. So chewing gum basically stimulates the salivary fluid, basically increases, so it can help prevent against bad breath. Chemical reduction, for example, using chlorohexidine, essential oils, triclosan, hydrogen peroxide, or baking soda. These are different form of products available for which come under the chemical form of procedure used for reduction of breath malodor, and conversion of volatile sulfur compound, which is metal salt reduction. Now, the importance. Why is it important? Because breath malodor has important socio-economic consequences. A proper diagnosis and determination of the etiology allows proper etiological treatment. So the diagnosis is very important, that what kind of a malodor is the person suffering from. Can be a sign of undiagnosed disease. It might be a sign that a person is suffering from a disease, for example diabetes, and the person does not know that he has diabetes. So it can be a sign towards identifying that the person is suffering from diabetes. It can be a social problem also, because it causes huge embarrassment that a person has a bad breath. Any questions? That is all it about it, and if anyone has any kind of question, they can please comment down below, and I'll be glad to help. Thank you so much. This is Noor Mustafa signing off from Educationist. Allah Hafiz.